Are you taking prednisone for ITP like I had to and thinking there's got to be a natural alternative to prednisone because taking prednisone feels almost worse than the condition itself? At least that's how it felt for me. I felt that the side effects of prednisone were worse than the ITP itself. I'd rather run the risk of having low platelets than deal with how miserable I felt on prednisone. So if you're wondering if there's anything that you can possibly do to help support your platelets, I went through the natural medicines database and found a list of possible natural substitutes that may support platelet production and help with thrombocytopenia. Now, the natural medicines database is an evidence-based database where they've combined all of the scientific studies for natural ingredients and then ranked them by their effectiveness from not effective to possibly effective to likely effective to effective. It's basically an FDA approved drug at that point. And so for ITP, there's one that stands out, and then the rest, there's what they call insufficient reliable evidence to rate. And so I want to go through these 5 or more natural substitutes for prednisone for people taking it for ITP. And in here, cover the level of evidence and potential ways of using them. And at the end, if you absolutely have no other choice but to take prednisone, I have a way to make that experience not so horrible. So first of all, the big standout ingredient, natural substitute for prednisone for ITP is melatonin. They've done studies that show that melatonin is possibly effective to promote platelet production. The reason is because it helps with anti-inflammatory and getting restful sleep at night. And so the idea is when you're getting restful sleep at night, your body can make platelets. And the studies have shown that a really high dose, we're talking 20 milligrams taken on a daily basis, promotes platelet production. Normal doses of melatonin is around 2.5 milligrams or 1 milligram. And so we're talking 20 milligrams that you'd need to take of melatonin. So I would personally not just jump straight to 20 milligrams. If it were me taking this for ITP, I would start out at 2.5 and slowly every night increase the dose and make sure I can tolerate it, because the worst thing you want is to not be able to wake up in the morning and function. And so slowly work up to whatever dose you can tolerate, the highest dose you can tolerate for platelet production. And the dose of the studies was 20 milligrams, and they found that to be safe for the people in the studies. It's just, you got to work out for you specifically where is a safe dose for you. So that's melatonin, the big standout, most effective. Second is berberine. Now, berberine is a naturally occurring plant alkaloid that is often in barberry plants like Indian barberry. And it is anti-inflammatory and has been shown to be quite effective for a lot of conditions, but not necessarily that effective for ITP. So it has insufficient reliable evidence to rate, but it may help provide platelet production boosting qualities. What it's really good at are things to do with metabolism. And some have called it nature's Ozempic. Others have said it should be an FDA approved drug. It works so well. So let me tell you what those are. Diabetes, Helicobacter pylori, hyperlipidemia or high cholesterol, hypertension or high blood pressure, and polycystic ovary syndrome. These are the conditions that Natural Medicine's database showed that berberine was possibly effective for. And it is a really amazing naturally occurring substance that can help with our metabolism, metabolic syndrome related symptoms. And so if you have ITP and those other symptoms, then this is a great alternative for you. The studies for ITP were 15 milligrams a day, and the studies for these metabolic syndrome is 1,500 milligrams a day. And normally it's taken 500 milligrams at breakfast, 500 milligrams at lunch, and 500 milligrams at dinner. So that's berberine. Number 3 is beta-sitosterol. And there's just not a lot of great evidence for this one, but it might help. Number 4 is magnesium. Magnesium might be potentially beneficial for people who have to take prednisone. And because magnesium is used in over 300 biochemical reactions in our bodies. Having low magnesium impairs a lot of things, from your heart to your muscles to your sleep, to the list goes on and on. Whether you have constipation or diarrhea, it's so vital to get the adequate amounts of magnesium that it's almost a harmless way of boosting all of those systems. And so even if there isn't the greatest evidence for ITP, magnesium has very few side effects. And if they are, you just take a lower dose. Like, for example, you might get diarrhea if you take too much. Well, just take less. And most people are low in magnesium because there's not a lot of magnesium in the food supply. And so taking magnesium is a great way to minimize your inflammation and improve these biochemical reactions. My personal favorite kind is magnesium glycinate because you can get a double hitter. You get magnesium and all of its benefits, plus it's bound to glycine, an amino acid that helps you feel calm. And so the combination can help you get restful sleep if you're having to take prednisone, for example, and it's making it so you're having a hard time sleeping. N-acetylcysteine is number 5 for ITP. N-acetylcysteine is an anti-inflammatory that is often used in like liver cleanses, and it helps just kind of bind up toxins in the gut. And people have hoped it would help with ITP, but there's just not enough evidence to show whether it does or not, though it might help. And finally, number 6 is papaya. It's usually a papaya leaf extract that people are looking for, though they're pretty hard to find. If you can find one, maybe it'll help, maybe it won't. There's just not enough evidence at this time to say for sure whether it does or not. So those are the 6 ways that you can potentially reduce your need for prednisone by boosting your platelet production with ITP. But if you have no way to avoid using prednisone, like I did, having to take it for 9 months when I had ITP, in that 8th month of taking prednisone, I had this epiphany, and it was, there has to be something better for people who are reliant on prednisone to save their lives like us. And I realized that prednisone is stealing nutrients from the body. And that's what's causing the side effects. This nutrient depletion causes side effects. For example, in pharmacy school, every pharmacist learns that prednisone causes osteoporosis, and so you have to take calcium and vitamin D along with it. Did they tell you that? Probably not, but you're supposed to be taking it because it causes osteoporosis. And then I realized that chromium picolinate is being stolen, and that is leading to hunger cravings and high blood sugar, diabetes, and muscle loss, and on and on. And so I realized that if you give back these nutrients that prednisone is stealing, you won't feel so awful while on prednisone. That if you have to take this poisonous medication, that the least you can do is replenish what it's stealing. So one day I was having to take this again because my platelets crashed, and they'd also had to start rituximab chemotherapy. And I was taking the combination of the two of them, and I was feeling horrible. And that's when I realized that people on prednisone need their own supplement. So I invented it. It's a Neutronized Zone, and it's meant to go along with prednisone. So you take 2 capsules in the morning along with prednisone, and then 2 capsules at bedtime to help reduce the side effects of prednisone. And guess what? I included 3 of those naturally occurring substitutes for prednisone in here. I've got the melatonin to help you get restful sleep at night. I've got berberine to help with your metabolism. And finally, I've got magnesium glycinate. So the combination of those 3, plus the other nutrients that you need while on prednisone, may help boost your platelet production and help you feel like yourself again while taking prednisone for ITP. So all you have to do is go to nutranize.com, Nutranize, to get this supplement, the first and only supplement for people on prednisone, and specifically designed for me who had ITP for when it comes back again. And so just get the Neutronized Zone to boost your platelets and feel like yourself again while on prednisone. Signing off as Dr. Megan, your prednisone pharmacist.